Welcome to Multnomah County. We're glad you're joining our organization. At Multnomah County, we want community members to feel a sense of trust when they come to us for help, and that same commitment goes for the employees who make our government run. In recent research on trauma, the ACE study demonstrates a lot of people have had experiences of trauma, many more than you might think. These experiences interfere with physical, mental, and social well-being throughout their lives. They can lead to poor health outcomes and even early death. So, trauma has long-term impacts on both brains and bodies. It also has ramifications for how people relate with others, whether that's community members who need help or services, or other Multnomah County employees who want to be productive at work. Because these experiences are so common, we promote an approach of universal precaution to both the community we serve as well as the people who work here. This means that we assume we should be careful with everyone, rather than only be careful when there's a sign that we should be. Trauma-informed organizations understand the vulnerabilities of trauma survivors. They know that service delivery that's not trauma-informed can sometimes trigger memories of past trauma and keep that person from accessing the services they need. So, okay, what does it mean to be trauma-informed? We're going to give you some ideas.
Safety refers to the physical environment, but also to the psychological safety of community members and employees. It's important for people to be safe and to feel safe. For those who've experienced trauma, the world can seem to be a dangerous place. That's one of the known repercussions. They may be constantly worried, which can cause them to have difficulty concentrating or anxious when engaging with anyone in a position of authority. At some point, you've probably met someone who's so fearful that they show up in a defensive, combative way, as if they need to protect themselves. If you're unaware of a person's history of trauma, you can easily perceive them as difficult, disrespectful, or unwilling to engage in services. As a trauma-informed organization, we want to make explicit efforts to give a sense of personal safety. That means we want to be attentive to the physical surroundings and to be mindful of how we talk with people.
This is the Multnomah County HIV Health Services Center. We have been open since 1991. We are a primary care medical home specifically for folks who are living with HIV. We have about 1,400 patients in the clinic. Every one of our patients works with a case manager who can help them connect with insurance, get referrals for food, housing, help them with coordination for mental health and drug and alcohol services, kind of whatever someone needs is what we try to help them do. So my name is Emily Bork. I'm the program specialist senior in the clinic. I'm the grants manager and kind of quality improvement person. And so part of my job is kind of leading and facilitating our trauma-informed care work group here, which is called TikTok. We actually spend a lot of time thinking about how to help both our clients and patients feel safe in the clinic and our staff to feel safe as well. We have folks that come here with a lot of different things going on, mental health issues, substance abuse issues, experiencing homelessness and crisis. So people come in already with a lot going on. They're bringing a lot with them. One of the things that's really important to us at the clinic is what we kind of call universal precautions, which is the idea that we don't necessarily screen all of our clients to see whether or not they've experienced trauma. We're not spending a lot of time trying to figure that out. We just assume that most of our patients have either a history and or current trauma going on. And we try to approach them in what we call a trauma-informed way, which basically just means with that in mind.
Trauma is characterized by surprise and uncertainty, and these painful experiences often occur within trusted relationships. So because the effects may keep people from requesting support from family, friends, or community resources, trauma-informed organizations don't assume that trust is a given. We tell people why we're doing what we're doing. And when things are unavoidably unpredictable, we take steps to provide reassurance, and we adjust our expectation about how that person might respond.
So my name is Kate Schwab, and I'm a librarian at the Central Library. And part of my job as a librarian here is to work with people experiencing homelessness, to work with people in the community by reaching out and finding people where they're at, where they're already accessing services, and then also to develop programs here in the library specifically for people who are in transition or who are on the streets. Being trauma-informed has definitely changed my approach to how I talk to people in the library. Instead of approaching the behavior first, I really approach the person first. I introduce myself, and if they're interested in telling me their name, they can tell me their name. Because I'm approaching them as a person as opposed to a behavior, people are like, oh, okay, I get it. It's like they already start to change before I even have to tell them what the rule is.
So my name is Hoon Tang, and I'm the Trauma Healing Manager for Multnomah County Health Department. And really what I do is to help the health department create a culture that is healthy and supportive of its employees. So trust is about, in the workplace, it's about taking time to get to know each other before we jump into a project. It requires a lot of investment. I think before we give that questionnaire, before we do what it is that we're supposed to do at the job, really take some human time to get to know them beyond their particular present circumstances.
One common aspect of trauma is that it's isolating. Survivors often experience shame and stigma. It's human to blame ourselves for the bad things that have happened, even when they're clearly out of our control. Whether a person is an employee or a community member, making genuine connections is important. Cultivating the support of peers can be a conduit to trust and to hope. Sharing stories, building community, and finding common ground promotes healing. That's why so many of our programs promote community members connecting with each other in supportive ways. If you're an employee here, that connection could occur through an employee resource group or a peer support network. Of course, you can also be one of those trusted peers for someone you work with.
My name is Corey Murphy, and I work in the HR unit here in DCA. I work primarily around organizational culture development. And in simple ways, to explain that, is around helping different people work better together. And that's sort of a simple way that I explain kind of what I do. Facilitating connection is the key. Creating spaces that encourage people to talk about their values, to talk about their skills and their perspectives. Sometimes the opportunity is not clear to be able to connect on a human level, right? And so facilitating those opportunities is important.
Ann Potter. What am I doing here? You know, it's really kind of funny that you asked it that way because I've had many different jobs in my adulthood, and most of them were because they were things that I thought that I should do. And then I got to a point in life where I thought, you know, I'm gonna start doing what I want to do. And what I've always wanted to do was something with dogs. And as a result, I started fostering for the county in 2004, and then 2 years later, I took a kennel job so I could get health insurance, and then after that, it just kind of took off, and here I am 11 years later, working for the county in animal services. If a pet owner can make a mistake with an animal, we have probably done it here. I know that the consequences of not keeping my cat in my yard, which I have finally figured out after all these years, is that I have to go pick it up at the animal shelter. So when somebody comes here to pick up their dog or their cat from the animal shelter, I'm like, I get it, mistakes happen, it's happened to me. So I think if we're honest, if we aren't on our, pedestal, preaching to somebody about how they should be, but we're there and we're talking to them person to person about, yeah, I've been there too, and people don't resent sharing experiences the way that they resent being told what to do.
Many survivors of trauma experience not being heard or valued in their relationships. They feel invalidated or that they have no voice.
Trauma-informed organizations know that healing happens within a respectful, caring relationship in which people are involved in solving their own problems and challenges. This is true whether you're a community member or an employee. Whenever possible, we share power and the decision-making. You can communicate that you value someone by listening to their perspective and involving them in addressing their challenges. When we do this, we restore power and self-worth.
One of our goals is to develop programs that we present at the library with the input and even the participation in presenting those programs with people, working with people experiencing homelessness. We are starting by getting input about what those programs should be, and as we move forward, we want to engage folks more. One idea that we're working on is a film series, and so instead of us choosing the films, it's going to be a much better and a much more inclusive series if we have our patrons choose.
So a dog comes in, it's bewildered, there are weird sounds here, there's a lot going on. The first thing that I like to do is like pull it into a quiet space, let it calm down a little bit. I give it treats. Usually it won't take treats at that point because it's too wound up. But actually still one of my favorite things to do because I like that transformation of them being like, oh, I'm so stressed to, okay, this is a safe person. And with dogs, that's by giving them some treats and some space. With people, it's kind of the same way, except I don't give them treats. I let them see that I'm a safe person. I bring them into a space where they're not in public, they're not being judged, everybody isn't trying to hear what they're saying, and I just let them tell me what their story is. And I think when people think that you hear them, it makes all the difference in the world.
When workers in the workplace don't feel like they have any say over their lives at the workplace, it gets really disheartening and disempowering. So it's critical. It's one of the most, I feel like, the most important pieces in creating a trauma-informed organization. It's ensuring that the people at the front lines, the people closest to the pain, are heard and their voices are cultivated and considered and integrated into policies and practices and how we do things.
Many survivors experience trauma in relationship to an authority figure, which can rob them of a sense of personal control and autonomy, leading them to feel passive, indecisive, and overwhelmed. Here again, trauma-informed organizations assist community members by recognizing their strengths, developing their skills, providing equitable access to resources, and letting them make decisions whenever possible. This also goes for employees.
A lot of trauma is people having their power taken away. And also I think asking people for their consent is really important. You know, this is what I need to do today in order to help you get what you need. Is that okay with you? And being open to someone being like, today is not a good day for me to do that. And you know, saying, okay, well, let's figure out when we can get together again to meet that need. In any scenario of us providing service to another person, making sure that we offer choices and that we ask for consent is a really important way to be trauma-informed.
That distrust of government, it does come to the library. It comes in a lot of ways. Yes, the library is free to all, and it says it above the doorway, but people still feel like they aren't going to be able to fit in and think that the library isn't open to them because of their past experiences. And I wanted to give them a sense of ownership that it's their library. That exceedingly warm welcome is a way to connect people to the library beyond those, to get over those barriers.
People experience trauma when they experience hostility and exclusion because of their race, gender, economic status, or culture. Sadly, governments have historically done terrible harm to non-dominant communities. Discrimination and oppression continues to happen with alarming frequency, endangering some and making others feel fearful and unsafe. Communities can be distrustful of any efforts government makes to help them. As a trauma-informed organization, we validate the harms that have occurred. We work to repair and make amends. We tailor policies and services to ensure we are sensitive to the experiences of discrimination and oppression. We work actively to address these historic barriers to accessing resources. Most importantly, we take action to restore equity, dignity, and respect.
My job is to create systems and opportunities for those who are really marginalized to share their wisdom, and where we can actually integrate many of their experiences and wisdom into our policies and practices. So I'm looking at disenfranchised communities. I'm looking at folks who have a lot of potential and a lot of experiences, but are typically not heard and validated. I pay attention to what's going on with our employees and understanding the community traumas that they experience. And with that, being really creative and nimble in our programs and services and support so that we actually meet the needs of those individual populations. I think healing oftentimes for disenfranchised communities and communities of color requires to heal collectively and heal together because we come from a collective worldview.
One of the projects that I've had the fortune of working on in a really small way is how trauma could inform a $300+ million courthouse that we're building right now. Working with the design team, considering questions of who might be impacted negatively and positively by building this particular courthouse, what people groups will experience more trauma and maybe unintended, right? Those are the kinds of conversations we were able to have with the design team. The result now will be that the courthouse will be designed with a greater sense of how people will experience that facility. For example, tons of natural light windows. It will face the water so that you get a more serene feel if you're waiting for a hearing or something. Community rooms used for mediation and less courtrooms. And so there's a lot of design intentions that can go into how people will use it as a place of justice.
Being a trauma-informed organization means that whenever possible, we actively and intentionally follow the principles we've just reviewed. As a government employee, every interaction we have, whether with a community member or a fellow coworker, provides an opportunity to restore a sense of power, of safety, and of self-worth. Every interaction can be healing. The principles expressed here are aspirational. We cite them to raise understanding within our workforce. But there's another important element here. Being trauma-informed also means being humble, recognizing that as an organization, we still have a lot of work to do. There are parts of our government that struggle with understanding trauma and its impacts and how we need to adjust our approach. But Multnomah County is a learning organization, and it's a journey that we're all on together. Thank you for taking some time to watch this e-learning and to learn about joining a trauma-informed organization.